bone. You feel it right here, right? But why you guys should have picked up on it right away? When person get a hip fracture, they have the surgery called an ORIF.
Open reduction,
Station.
internal fixation.
So why would you say it's the pelvis? It is not the femur. It is not the pelvis, it is the femur.
Okay.
Lord have mercy. Anybody here, just tell me what you know about the femur. Anything about the femur. Anything you tell about the femur.
Longest bone.
Longest bone.
The longest bone.
Good, what else? What else?
Isn't that where the bone marrow?
It's happening within.
Guys, what you should be telling me as registered nurses, the head of the femur is 125 degrees from the shaft. So when you have a fracture, it more than likely is going to be happening between where you have that top there, which you call the trochanter.
Trochanter.
On that bone, you have the place for attachment of your muscles called the tuberosities.
Velocities.
And we went through, guys, don't play with this. That is why you answer, that's why I bring these questions. You're not going back and thinking, come on, think about it. We went through the bones. You're doing pathophysiology now. You get a hip fracture. Do you think you're gonna be having a plate in your leg? Absolutely. But if you think that a hip fracture is a pelvis, how the hell are you gonna have that in your pelvis? What are the bones in your pelvis? What are the names of the bones in the pelvis? Ilium, ischium, pubis.
Ilium.
And then you have that cartilage to be curved, it's called the symphysis pubis. And why you have to know? Because remember when we did this pelvis, we went through all the android, the platyploid, why some women cannot get what? Not pregnant, why some women cannot have vaginal delivery. We went through this thing. Lord have mercy. All right, let's move on. All right, so the answer, guys, is a femur.
Femur.
All right, number 13.
What is the name of the jawbone? This person got sinus bone.
The what?
Sinus.
Sinus bone. This is sinus.
What is it?
What's the chinus bone?
Put the man.
No, what's the chinus bone? See, you got just things in front of you. See what's the chinus bone. We're not just doing corrections when you're trying to understand and learn.
Sinus bone. I don't find nothing on that. Boneless chicken. Sinus bone.
Remember I told you guys when we started, that's a gift, we just give you a stupid question.
Is it Chinese?
And we talk about a person having a cold compress being applied to a leg that has a what?
Yes.
A cast on. It just don't make sense. So when you have these answers, you kick out the one that sounds and looks stupid. And you also got two that looks very close. Very close. And now you gotta make up the decision which one of those is the one that you need to select. And that's not going to be based on how much you know about that body part. Alright? So what is the lower bone? Or the bone in the jawbone?
The man.
Mandible.
Mandible. I was seeing when you talk about fractures, you hear that a guy gets punched in his face and get a mandibular fracture. And they have to wire the bones because the person will not be able to what? Eat. They'll not have to speak properly. And they'll have to wire it up. Right? Because you can't put on a cast in it. Okay? Next.
How many bones are in the adult human body?
How many bones in the adult human body? How many?
206.
Correct. Next.
How many bones do you have at birth? 270.
Okay.
How many?
415?
Ooh.
No. 270.
All right. Next. That's the last, number D, or D, or what is that here? Number 4 or D? Okay. Next.
Which bone houses the brain? Cranium.
Okay. That part that you tell me something. What is xiphoid?
Say it again.
What is xiphoid? It's on the paper there. What is xiphoid?
Oh, it's like in the vertebrae.
Tell them again where the xiphoid is at. Tell them.
Oh, it's right under the rib cage, over it.
It's at the end of your sternum. And you know, when we did that part, what did I say to make you remember? I said that sometimes when you're doing what? Chest compressions. When you're doing what? CPR. And you gotta really bring that person back. Bring that to the brain. Xiphoid process. So, is it the cranium?
Yes.
Houses the brain.
Cranium for the brain.
It's 100% the cranium. Sir?
Somebody put that.
What are those lines in the brain that you see, on the cranium? What do you call those lines?
Sutures.
So, and when you're born, what's the situation with those sutures?
They haven't fused completely as yet.
Which one? When you said they? What do you mean by
It
they?
hasn't fused completely as
No,
well.
not it. Stop guessing.
Okay.
What is it you're talking about? What about the sutures? And what about the sutures that we talk about? Because the sutures which divided the brain, the skull, the cranium into things such as the frontal, the temporal, the parietal, the occipital, right? But what you want to know about the sutures when the baby is born?
It's very soft. It's not fused.
It has to be soft enough to go.
Remember you did your what? Your fontanelles?
Right.
So the sutures are open. You have your anterior and your posterior fontanelles. And we even said that in certain cultures people talk some stupid stuff, but they sometimes be serious. A mother will say things such as, when you're born, I should have taken a pin and push it into your fontanelle. Then she said, I should have killed you when you're born because you're no good now. Because it takes a while for the what? For it to know that you use the word fuse. So when you hold the baby and you press in here, you'll find it's what?
Soft.
When you now come to do things such as hydrocephalus. And what is hydrocephalus?
Water in the right.
You still talk about that cranium thing.
Fluid in the cranium.
So you have fluid, lots of fluid. And what's the fluid you have in the head? What's the name of the fluid in the head?
Cerebrospinal. No. Yeah? Yes.
You're right.
Yes. Yes. Yes.
So you have the cerebrospinal fluid, but that's supposed to be drained. It don't just stay there all the time. So if it don't, what happens?
It became hydro.
The baby, because the sutures is not going to be what? Closed. And because of the pressure, it's going to be?
Expand.
There you go.
Hydrocephalus.
So you see how it connects?
Mm-hmm.
Your sutures, your cranium.
Check out for 17. Me too.
And just to reinforce it, guys, please look at hydrocephalus.
Okay. You gonna test about it on Monday?
Hydrocephalus.
Cephalus.
Cephalus, okay. Hydro.
I want to look at an image.
Oh, you wanna do it now?
So there's something I asked you guys the last time when we were talking about this. I said there's something that's very specific about these patients that you need to remember. Did you see the hydrocephalus baby?
Yes.
The head looks big, right? Large. The head is kind of long.
Big.
Now, with these hydrocephalus, you want to look at the eyes.
The eyes were small too.
No. Please look for something called the sunset
Sunset.
phenomenon.
Phenomenon.
As I did before. Look again.
Sunset phenomenon.
So when you look at the baby's eyes,
It's red. And the sun.
look at an image of an actual, see the face of a baby, the eyes, that you will see the hydrocephalus baby. You may have a question, sunset phenomenon patient, and they will give you scenarios related to a patient with hydrocephalus.
Huh.
Now the question you want to know, if a patient has hydrocephalus, will this patient have mental challenges?
Yes.
Questions. What is the life expectancy of a patient with hydrocephalus? 2, if the patient will have mental challenges. And 3, the treatment is more likely to be surgical. treatment. Somebody, not treatment, sorry. Life expectancy.
So many people with cephalic disorders live relatively normal lives, but some cephalic disorders are severe that the baby will die within weeks or months of birth.
Read out again, please.
Said, these disorders may range from mild to severe. This depends on the part of the brain and central nervous system affected. Many people with cephalic disorders live relatively normal lives, but some cephalic disorders are so severe that the baby will die within weeks or months of birth.
And that usually happen where? In those third world countries. Because they can. So now you want to go to the treatment. How would they take care of this situation where you have this accumulation?
Did we go to number 17 yet? Oh, shit. No, okay.
Look at the the shunt. So you have surgical. So the only basically treatment that you use it is surgery. All right. We talked so much about shunting thing last night, and we talked about the movement from portal to there. Hepatic. Portal vein to the hepatic vein to bypass there. Liver, right? While we talking about the skull, I want to talk about certain things with the skull. We have persons that have an enlarged skull. And this is now we're talking about adults. What is the condition that we call with enlarged skull? What is the general condition? In fact, the person can grow like a giant.
Acromegaly.
Acromegaly. So you have acromegaly, which is another medical term for what? Local name. What's a term, what's a local name for acromegaly? So if you see it, you know what it's all about. Look up for gigantism. When we did this, we tried to remember it by saying, if you guys remember the guy who used to do wrestling called Andre the Giant, and we talked about that. And we were trying to remember this condition. Hormonal disorder. Do you see the gigantism? So, if you have scenario where a person have gigantism, acromegaly, what would that person be at risk for?
Headaches, oh no, the symptoms is like headaches.
Heart
Some
problem,
things we
heart
talk about.
problem, bone conditions.
Why you say bone condition? So overgrowth to mean that they're gonna have a problem?
Possibly.
Come with facts, right? So normally, as I told you guys before, when you get these situations, you ask about what would be the complications related to acromegaly. That's where you, as a nurse, got to know what is what. The signs and symptoms, so you go with the complaints of the patient. That's how you develop your care plans. So see what is the complications.
Complications include cardiovascular conditions such as hypertension in children, bone conditions such as
Do you normally get
osteoarthritis.
hypertension in children?
No.
Because we know how hypertension, we know about your essential as your primary hypertension, we know about your secondary, we know about your what else? Your hypertensive crisis, right? And we kind of relate it to the disease conditions. And now you have a disease that can cause a child, when you're doing pediatrics now, to have hypertension. Are you guys with it? Acromegaly in children can cause them to have high blood pressure.
But why?
So that's the underlying cause, hormonal again.
Also, you can have, sorry, continue. Also, you can have bone conditions such as osteoarthritis. Also, you can have diabetes mellitus.
Why do you think they're gonna have osteoarthritis?
Double vision.
The bones are growing too fast.
Look at image of a person who has gigantism. Don't look at this guy here, Andre the Giant, because he's abnormal. Because you know he used to wrestle and fight and lift up and knock down. But look at another guy, look at the person who have acromegaly.
Robert Wadlow. Gigantism.
This is going to bring you now to what is osteoarthritis. How does osteoarthritis? What's the difference between osteoarthritis and what? Rheumatoid arthritis. Rheumatoid, you know, is what? Autoimmune, when the body is attacking its own self.
Yeah.
So with the osteo, person has weight, right? They're big. Joints are involved. So when you get these type of, what's the word you use? Stress? Good word. Alright? If you see how you just put it together like that. Tall, size, weight, have a problem. And you know between your bones you have what? What is between your bones?
Cartilage.
And what else is between the bones?
Veins.
What else is between the bones?
Blood vessels. The disc.
Synovial fluid.
Okay.
Because that's what we're talking about osteoarthritis. Because the cartilage is now what? And the fluid that is in your knee. That's supposed to prevent that problems with wear and tear. So when you have these problems, you get osteoarthritis. Alright? What are the complications?
Diabetes, let me read that again. You can also develop diabetes mellitus, insulin resistance. You can get polyps in your colon. Why?
One of the things I want you guys to do, please, is please go over your hormones. Your autoimmune, sorry. Because then we're going to be talking about things related to the endocrinology. And we have done some stuff about the different type of hormones. We talk about hormones being coming from ductless glands and their messengers that carries messages around the body for things to be done. Just review it. Okay? Just review it, please. All right, let's move to the next question. And by the way, you have people who are born that way, but then you have people who will take their cranium and make changes to the cranium. Especially in places like Africa, different tribes, they put the child's head between boards and what have you, so that when the child grows up, as the child grows, the head will be elongated, or different things can happen. Now you're going to say that's a stupid thing. That's not a stupid thing. Because culturally, and people have their cultures, people have their beliefs. Okay?
Want to go through the signs and symptoms?
Okay.
We need to finish. Gigantism. Let's
No,
get
no,
to
no. We've done a lot on that, and we got much more to go on. Next.
Are the bones called that make up the fingers and toes? Are the carpals?
What are the bones called that make up the fingers and toes?
phalanges.
Cranium is right. Number 18.
Number 18.
What is another name for the collarbone? Clavicle.
Another name for the collarbone is there.
Clavicle.
And where's the carpal bone? Oh, you remember what's the thing that said that people get? Carpal. No.
My metacarpal is
Carpal what?
Carpal
tunnel syndrome.
Xiphoid process.
Carpal tunnel syndrome, you know right away it's there.
I found this on the web.
Sorry.
Next.
What's the for 18?
Clavicle.
It's the last, it's D or number 4. Now 19.
Which long bone makes up the upper part of the leg, the femur?
8. Yes. We've discussed a lot of that, so we can move on to 20.
In the lower legs, which bone in the larger on the two main bones? Tibia.
Tibia is right. And that's number 1. 21.
In the lower legs, which bone is the smaller of the two main bones?
And it is, sir?
Tibia.
No. It's B or the fibula. Guys, remember when we did fractures? We talked about different type of fractures, right? We talked about open fractures, closed fractures, displaced fractures, impacted fractures, transverse fractures, brain stick fractures. Did all those fractures. Just review them, please. Okay, moving on.
Which of the following is not a bone in the earth? Is scapula?
Which of the following is not a bone in the ear? The answer will be number 3. Where is the scapula?
Bless you.
Where would you find the scapula?
Yeah, the first.
Right, the
The
shoulder,
breast.
right, the back of the shoulder, right?
Behind the
The shoulder blade.
blade.
Mm-hmm. I got that right too. Woo-hoo. That was a hard question.
The scapula. Number 23.
What are the small bones that make up the wrist area called? The person had carpals.
And the person is right. Guys, look at the bones of the hands, please. Image, bones of the hands.
Bones of the hand.
Now beginning from the wrist. What's the first bone going down?
The wrist. Phalange. No,
You're not nowhere near the
Bone
phalange.
of the wrist
One on the wrist.
is the
Scaphoid.
scaphoid, the
Trapezium.
and
Capitates.
Now look for the carpal bones.
carpal.
All that will be carpals. Look and see where is your carpal bones.
Carpal is right there. Scapuloid.
Look at the image. Where do you see the carpal bones?
Right on the wrist. Right on the wrist area.
Now where do you see the metacarpal bones? Before your phalanges. Phalanx is one. All right.
Carpal is before.
So you're not going to forget this now. You remember we just said carpal tunnel syndrome?
Yes.
It's because it's what? The wrist,
The wrist.
is a problem.
Right.
So when you talk about the carpals, it will be the wrist.
Right.
And then when you come here, that's the metacarpal. The same you're going to do when you go to the feet.
Tarsals.
The what?
Tarsals.
Tarsals and metatarsals.
Metatarsals.
phalanges. Okay?
Carpal tarsal syndromes.
Which one is next? Number what?
24.
What are the small bones that extend beyond the small bone in the waist?
That's the 24.
Which is the
What,
the
what,
23 was D.
23 was the last one, D,
Couple.
or number 4.
24.
Now it's number 24.
So what are the small bones that extend beyond the small bone in the waist and make up the lower portion of the head?
Number 24. Come on, guys. What is it?
Metacarpal.
The first one, metacarpal.
That was a hard one. That was a hard one. Oh, God, that was a hard one.
Now number 25.
25.
What are the small bones that make up the heel and ankle area of the
Tarsals.
that person get A and B?
It's only one.
So just pick one for them. Just pick one.
I don't know.
Go with your metatarsals. I want you guys to look,
Is the answer?
Metatarsals.
right, look at the ankle, the name of the bone in the ankle. Look for the name of the bone in your ankle.
Those are the tarsals. Oh, man.
No, look for the bone, this bone here, that you feel.
Bone that makes up
The one that you get here.
heel.
What's the name of that bone? Here.
Talus. Talus ankle bone.
Calcaneus. Calcaneus. Tibia talus calcaneus. Metatarsal. Tarsal and metatarsal. Tarsals. It says tarsal on it. Tarsals.
Look at that bone again. Look at the name of the bone. You know, somebody say I got hit in my ankle, or I need to get an ankle guard, right?
Talus ankle bone.
I mean, so many different things.
Tarsals. Says tarsals right here. I'm going with tarsals. Cause that's what I picked, so I'm going with that. Heel bone. Heel bone. It says tarsals.
The heel bone.
My computer says
Look
tarsals.
for calcaneum. Calcaneum.
Calcaneum.
Calcaneus.
Calcaneus. Calcaneus bone. Tarsals.
I'm just asking to look for calcaneus.
Calcaneus. Yeah, it says calcaneus. That's the bone right here on the heel. Calcaneus.
Where you get the calcaneum spore.
But all that is the tarsals. It says that right there. Calcaneus, aka heel bone.
And in the question, the specifically, read the question again.
It says, what are the small bones? Plural.
That make up there?
The heel and ankle area of the foot.
The ankle area.
Heel and ankle area of the foot.
Remember when we started the wrist? What did we say have first? The carpals, then the metatarsals. And I say you do the same thing when you, carpals and metatarsals.
Metacarpals, yeah.
I said the same thing when you go down to the feet, right? Didn't I say that?
Yeah. Tarsals and metatarsals.
Metatarsals. Despite the fact that you have, and they did not mention any of those bones, like the calcaneus bone. They didn't mention that. They give you that, so you go with what they give you. They didn't ask you what's the name specific of the heel bone. They asked you about the bones that's located where?
In the
Ankle,
ankle.
the heel. All right, so definitely that's going to be your tarsals. When you get to do your instep now, notice if you got some flat foot, that's no way you're going to be going into your metatarsal area. What?
Tarsals.
Okay, take this one.
Meta. Okay. No problem. No problem. It's tarsals.
Number 26, what are the small?
The question said, what are small bones that extend beyond the small bones and the lower portion of the hand? Look at it very carefully.
The answer is tarsals.
Alright, now let's move on to, right here.
Mr. West, what the
25,
answer?
sorry,
What
25.
the answer for 25?
25 is the tarsals, what are small bones that make up the heel and ankle area of the foot. Once you have heel in there, once you have heel and you have ankle, ankle is the first thing we take preference, right? Ankle moving down to the heel. Because I'm going to say it again, your instep, you know when you go for your toes, you have that part there, called the instep.
That's a ball.
That's the metatarsals. When you get fractures, you can get fractures in the metatarsal area. You can get fractures in the tarsal area, especially people who play things like soccer or what have you. Those are the areas. Who will be at high risk based on the type of sports they play or for the
Football
type
players.
of jobs that they do?
Not boxers, football
Okay.
players. Basketball players.
And what join bones to bone? What connect bones to bone?
Muscle. Cartilage. Huh?
Just ligaments, alright? Ligaments connect bones to bones.
Ligaments connect bones to bones.
Alright?
What connect bones to bones?
Tendons get muscles to bones.
Here's an answer from Wikipedia Malarkey. The ligament is the fibrous connective tissue that connects bones to other bones.
Alright, let's
Number
move on.
26, what are the bones that extended beyond the ankle bones and connected to the phalanges? Metatarsal.
Now we're gonna metatarsal because it's moving. Right, that's the instep now, right? But remember, the phalanges is all your toes and your fingers. You can't go wrong with that. Next,
What's another name for the
number 26 is B. Metatarsals.
What's
Alright.
another name for your toes? And we have phalanges.
Number 27.
Where's your anticubitals? Right, you remember that from doing your practice, right?
Anticubitals.
For your blood pressure. No, that's not your anticubitals, that's your upper arm.
Anticubitals.
Anticubitals here. Alright, let's go.
So what's the answer?
The 26?
27.
Metatarsal 1 is another name for your toes, and phalanges, which is number 4 or D. Let's go to 28 now.
What is the name for your kneecap bone?
I think I got patella. I don't know.
Look for the word knee exoid.
Nexoid.
Knee exoid and kneezoid. Sorry, it's kneezoid.
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 Here's some information.
Knee
It's a kneecap.
OID. XOID.
XOID.
Say it?
It just,
The kneecap.
for kneecaps, and then
Kneecap.
shows the patella. It doesn't say ankle.
Because there's no such word. All the time you see me giving you guys, and you guys still not catching on. You gotta try the stuff that is crazy.
What happened?
These are the
This
paper.
stuff is crazy. And you know that the kneecap is the patella.
Okay, now I know.
Alright, next.
Oh, what is the name of your tailbone? Coccyx. That is correct. Sorry. Coccyx, 4. That's the answer I got here.
39 is D, number 4. The coccyx. How many bones make up your coccyx? How many bones make up your coccyx?
2 bones.
It's like 5.
Coccyx is your tailbone, right?
It's 2 bones.
7.
Only 4 bones that make up your coccyx, and those are the only bones in the spine that is fused. It's a fused bone. You guys still looking for it? Coccyx. You guys don't see the coccyx?
Oh, the coccyx?
Part
Coccyx.
of the vertebral column.
Here's some information.
It's the last 4 bones
As the tailbone,
of
the
your
final segment of the vertebral column in all apes
vertebral
and
column.
other structure
And it's
such as
fused.
mammals such as
The
horses.
bones are
It's
fused.
the remnants of vestigial tail in animals with bony tails. It's known as tailhead ducks. Alright.
No, you guys did this many times. We went through those bones, we count those bones, those 4 bones in the coccyx. It's always fused. People call it your tailbone. And we went through that one many times. In fact, we say a lot of times, people, it's called the coccygeal decubitus. They call it sacral decubitus, but it's not a sacrum. The sacrum is higher up. The one at the tailbone is not a sacrum, that's a coccyx. So it's a coccygeal also. Alright, let's go.
What is the largest bone in the human body? Humerus.
So, humerus?
Yeah.
No.
This one, look.
Oh, the person cooking, okay.
Filmer.
Femur.
Femur is the
Why not the vertebra? Why not the vertebra that start all the way here to all the way?
It's a mixture of many bones.
There
It's not
you
just
go,
one bone.
Because it's, how many bones?
How many in the vertebra?
30,
It's 9, 12.
33 or 33?
No, no,
33.
33 bones.
I was
So if you have
counting.
33 individual bones, it's one long connected bones, not one bone. So the one bone is going to be your,
Femur.
right, so femur is there.
Correct answer.
The top portion of the sternum is called
God, that one, I know.
xiphoid process. Xiphoid process.
The top bone of the sternum is called there.
Xiphoid process.
You guys look for manubrium, please.
Incus.
Look for the word manubrium. Look for manubrium, please.
Malleus. You said look up manubrium?
Look for manubrium. Look where it's at.
Manubrium.
Look at the sternum. Look at
I didn't get that. Could you try again?
Says the medulla is
Manubrium, sternum.
I remember I was just talking to you guys and I said when they do the cardiovascular, the
That is the right
CPR,
answer.
you could break the tip of your xiphoid process on the sternum.
The answer is manubrium.
So that's at the bottom. The xiphoid process is at the bottom of the sternum. So what's the top? And that's why you can eliminate the other two. What's the other two there? Carpals or what?
Carpal.
Right? And you know that's in what? The hand and the foot. So that's what? Wrong right away. So now you have to make a decision on those 2 points of their sternum. So manubrium is the one that's at the top.
So I'm guessing you got it right, huh? Yeah. The incus is the ear.
Alright guys, next.
Critical thinking. The
Come on
bottom,
guys.
the bottom.
Amber. 32.
The bottom portion of the sternum is called
The xiphoid process.
the process.
The xiphoid process. That's B. Okay, 33.
I guess. Scapula.
Number 3 or C. It's the scapula. Let's go 34.
I got it right.
That one goes to the lower column, base, cardiovertebral.
The top bones of the vertebra are called the
Cervical vertebra.
cervical vertebra.
Yes.
Now, how many bones make up the cervical vertebra? How many bones make up the cervical vertebra?
What's that? 7?
Why are you talking?
Yeah, talk loud with
Not
confidence.
saying things like that. Remember when we talked about the vertebra, the cervical vertebra, we said that you have 7, but the first 2 is known as the atlas and the axis.
Okay.
Atlas holds the head up and the head turns on its axis.
Okay.
Just like the world turns in an axis.
I did pretty good. I got like 2 wrong.
Okay, next please.
The center bones of the vertebra are called the lumbar vein.
Oh no, this one wrong. I got this one wrong. Oh, the center bones. Thoracic. Thoracic.
Because of your thoracic.
Yeah, thoracic. That's the right answer, is thoracic. I think so. You got the cervical,
So we go,
thoracic, the lumbar,
cervical is up,
the
then
sacral,
after the cervical is what?
thoracic.
Thoracic have how many bones?
12.
Lumbar has how many?
The lumbar had
So you
5.
go with there?
Thoracic.
Why you go with the lumbar?
Why don't we go with the lumbar?
It's hand.
The center bone, they say the center.
You go with thoracic. Alright, next.
Thoracic.
The lower bone of the vertebral region make up the lower back area are called the lumbar vertebra.
Yes.
Alright, so they give you what? Cervical, cranial.
Cranial.
Where's the cranial vertebra?
The back of your head.
I never heard about that one. I never heard about that one. That's new science to me. It's not been discovered yet.
You guys taught the same thing over the...
I almost picked it.
Catch us this time.
I almost picked it too.
I get it now.
I almost picked it.
Throw me off.
Threw me off too.
So the cranial and the cervical is going to be true now.
Mm-hmm.
And so, what's the next two? Thoracic
Thoracic.
and lumbar. Which is the higher of the two? Thoracic. So the lower is going to be your
Lumbar.
That's it. All right, what's next?
37. The
37.
The large triangle bone that begins below the lumbar vertebrae and wedges between the posterior of the pelvis is called the sacrum.
I don't even know this one. I don't know what I think of this one. I guess.
That would be the car seat.
Look for the clavicular notch.
Pelvicular notch. I didn't get
I found it on the web.
pelvicular notch.
Hell?
I didn't get that. Could you try again?
Okay. Pelvicular notch. No such thing.
Showing results.
It hasn't been discovered yet.
So now you got just what? Coccyx,
Mm-hmm.
thoracic,
Thoracic and sacrum.
sacrum. And it said
Below the
If it
lumbar.
goes below the lumbar,
Lumbar
you better
vertebra.
count what? Thoracic.
Thoracic. Takes out
And
thoracic.
so now we left with what?
Sacrum and coccyx.
And what lies just below the
The lumbar.
lumbar?
The sacrum. I wonder if I got that right.
See, who got my paper?
Let's go with next. Sorry, next.
Next.
37
Two
is
bones
what?
from the lower arm, forearm radius. What are those bones called? The person have radius and ulna.
Okay, that's B. That's number 2. That's right. Next.
I'm a good
That's
guesser.
D.
I am a good guesser.
Which bone in the forearm region is on the palm side? The answer is C.
Gotta be
No.
No, what the person got?
Radius. Number of radius. All the right. Okay, finally.
Alright.
Last question.
That's me. Oh, which bone is the forearm region? Is on the pinky finger side. Ulna.
B, all
I
the.
cheated off of you. No?
Now, all the R's that you get, all the rights. Count all the rights.
1, 2.
Count all the rights.
3, 4, 5, 6,
All the rights.
7, 8, 9, 10, 11, 12, 13. I hope I did good at this test. Shit. Don't blame me, they were sleepy. 1, 2.
Now just put down on the upper right-hand corner, just put a large number.
5, 6.
Whatever the number you get, put it to the upper right-hand corner of the sheet.
Oh, excuse me.
Got it.
40?
Mr. West?
39?
40.
Give that 20% that.
Please. $20? No bad. I pass. That's what I'm married to. 30. $30 out of 40 is how many percent? 75%. What's going on? My keyboard stopped working. What do I do?
Throw it out. Throw it away. Buy a new one.
Click the arrow.
Marie? Marla Marie? Marla Marie. That's you? No, I didn't have you. That's you? Marla Marie? Whoever's Marla Marie got a 40 out of 40.
All right. When we look at the results, it's like half and half. 7 persons did not make the minimum secure to pass, and 7 did make them. No person got 100%. The highest was Rose, who got 33. Miss Washington, you got 31. here you got 30. Per land is 29. His cost is 28. Mr. Steer is 27. And Ms. Kage is 26. Everybody else got under the 25. All right. Based on what we just did, what was the glaring thing to you? What you found was glaring?
What was the question, sir?
What is glaring? What popped out at you? What stood out when you did that test, that quiz?
We did this already.
Absolutely, I know. That's why I give you guys back it. Now you've been able to compare and see what you guys did the last time to when you do it now. How much
Well, I feel like I'll do way better this time.
you feel? Remember we said yesterday with all those questions? No feelings?
Huh?
Nurses don't have no feelings. All right.
That's
so,
wrong. Gotta be empathic. Gotta have some kind of feeling.
What stood out? The first time when you did this test, you just finished doing your anatomy and physiology. So it was fresh in your mind. Now this is later down the road. And now we can compare and see what you did then to what you did now. Or do you agree with me that now you should have it better?
Yes, I agree.
Absolutely. But what stood out, I think, what you should pick up on is that when you're asked questions and they give you answers, these questions kind of check on your
Check your
ability
messages.
to. All right, let's go with your word reason, but I was going to say analyze the data. And with the data that came up, you see certain things were not even supposed to be there. But still, some persons choose those ones. So that makes me now question why they say, why would you want to choose those? Meaning that if you were in my place and persons are putting those answers, what would you think? What would be your deduction? Come on guys, don't be afraid to talk. It's just where you talk. What would be your deduction if you see things that perhaps have nothing to do with it? What would be your deduction? Person don't understand and the person is just guessing. And you gotta, guys, you just gotta face facts. You're not trying to hurt nobody's feeling. Nobody's name is being called. So the question is put out there, if you see something like that, what would you do? What would you think? And right away you'll be coming up with, maybe this person was fully understood. And on to now, this is a second test on the same. You guys going to be seeing a lot of tests until you get out to this classroom, which is hopefully within the next few weeks. And within those next few weeks, you have a lot of tests and then you have your final exam. So it's prepping you to come to the finals.
How many questions in the front?
I haven't decided which is going to be easier. But I can assure you the final exam, I'm going to be as close to the state. You know, they go there 65% or whatever. I'm going to be close to that. Don't worry, it'll probably good. If you notice, I did somewhat to the test, this test here, where I've done, all's done. Try to give you difficult questions, and then